So I actually grew up pretty close to Marshall here, just a little bit east of town. Yeah, so I grew up on a farm out there. Went to undergrad at Brookings, South Dakota, and then I did med school up in Duluth, and then residency in Sioux Falls, and kind of fell in love with South Dakota and practiced out in Pierre for a while, and then wanted to move kind of closer home, so it kind of brings me back to Marshall. So when I was in middle school, had a couple of family members that had some of their own medical issues, and so I had kind of some exposure to medicine kind of on the patient side of things, and kind of seeing how in like a scary and confusing situation that the doctor was able to provide kind of the clarity and the comfort to people in those situations. And I think that just really resonated with me. What I enjoy most, I would say, is my patients. So, and particularly when I can see them getting better, them being happy, them enjoying their lives more through what we can do to help them. That's probably the most exciting and rewarding thing, to see people getting better, and they come back and say, hey, I did what you said and I feel better now. And so it's hard to beat. So I try to gauge what my patients are really looking for, and I would say that I try to individualize things. I try to focus down on what matters to them, because you can read the best studies and the best guidelines, but at the end of the day, unless you're knowing something about the real person you're taking care of, it doesn't necessarily work. So I chose Avera. I agree with their mission. I agree that healthcare is a unique type of service industry. We are not in the business of serving coffee to people. We're in the business of taking care of people, trying to impact their lives, and taking care of people and their bodies. And people and bodies also have a spirit, and I think that Avera recognizes that. I think that that's something that really makes a difference. Yeah, so outside of work, probably most of my time I'm just spending with family, but if we can get outdoors and go kayaking, go hiking, and being outside and enjoying God's creation, I think that's a good use of our time.